Major support for Carolina Business Review is provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. And Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services with more than 300 operations in 35 countries.
Well, healthcare once again dominates not only the polls and the pundits' chatter, but beyond what plays out through political hyperbole. How will reform or replacement of almost 1/5 of this nation's GDP, that's healthcare, end up trickling down? Thank you, and again, welcome to the most widely watched source of Carolina business and public policy. I am Chris William. Happy summer, and we will jumpstart this dialogue in just a moment. And later on, joining us again, UNC Healthcare CEO Bill Roper.
Gratefully acknowledging support by Blue Cross Blue Shield of South Carolina. Please visit us at southcarolinablues.com. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. BARINGS, a leading global asset management firm dedicated to meeting the evolving investment and capital needs of its clients. Learn more at barings.com. On this edition of Carolina Business Review, Dr. Susan Roberts of Davidson College, Antjuan Seawright from Blueprint Strategy, and special guest Dr. William Roper, CEO of UNC Healthcare and Dean of the UNC School of Medicine.
Talking politics before the lights come up, that's always a fun thing. Well, Susan, Antjuan, welcome to the program.
Thank you.
Happy summer, and thank you for coming in. I know everyone's kind of got their mind on vacations. Susan, let's start with something. In the last couple of weeks, there was I'm not going to call it a surprise outcome for the Georgia elections, but this Republican-Democrat race in Georgia was seen as somewhat of a proxy for how Trump was seen in this country. Is that fair to quote it that way?
I think it's fair to quote it that way. I think one of the big issues is how anti is anti. Anti-Pelosi, anti-Trump, anti-establishment. It's not a bellwether, but I think it represents a lot of things that will influence 2018, especially, in my mind, money. And I'll get right to the point. I thought it was an obscene amount of money to be spent in a special election, especially one that was going to be an uphill battle for a Democrat. I thought that the Georgia race was one that a lot of national attention. I think that is one of the factors that, and I think you might agree, that really turned the outcome of that race. It was so nationalized.
Because of the press, or because of the money that flowed into Georgia for that race?
I think both, and I think that the press and the parties hyped the race so much that we put a lot of focus on that. And they had the story of the young politician versus the seasoned Paul,
right.
And I think you saw the effects of this is Georgia. Georgia has become a little more unreliable in terms of being Republican, even though the district was red and reliably red.
Okay, Antjuan. So is this defining of battle lines now on how it's going to be between Republicans and Democrats?
Nowhere close. This is essentially the pregame before the real game. The real game will be in 2018. Keep in mind, the only reason, Professor, this race was in place because we have a toxic president in the White House. Otherwise, this race would have probably never been on anybody's radar screen. The only people that hyped this race up to be more than what it is were the pundits and the inside baseball people. But if you live in suburban Atlanta where the district runs, you know that suburban whites in that district have traditionally voted for a Republican. And again, the only reason this race was in place, as any of the other races in the special elections, is because of how toxic Donald Trump and his party is that currently occupy all facets of our government.
Okay, well, let's not going to undermine that, but I will say at some point, though, even before Trump was a reality as a possible president, the monies that were flowing into local races was going up and new high water marks at seemingly every cycle. Isn't there some element of that in here too?
Well, partly, but it's the cost of doing business. And when you're in the minority party, you have to do even more to get a message out. Keep in mind, we came off a very brutal 2016 election cycle. And so for a lot of Democrats, particularly running these Republican-leaning districts, it's about trying to articulate and communicate a message that's going to resonate to the base and convince independent and moderate Republicans to come over, because that's what it takes to win an election. So the money was just another element in that.
How does, before we chase this too far off into a tangent here, how does health care overlay, and now what the Republicans are going to propose as being a health care plan, how does that play out into to all of this?
Well, I will say that it plays out into not just the anti-Trump, anti-Pelosi, it plays into really the issue upon which Trump made a cornerstone, as well as immigration, of his campaign. And I think there's so many stakeholders, and everybody is a stakeholder in the health care reform. I think depending on what happens in the coming weeks and months, when you see this teased out, it has a lot of things that I think Americans, as well as South Carolinians and North Carolinians, want to know, and that is cost, access, quality, how it's going to have an impact on all the races. Because, and I will say this, it has a lot to do with procedure. Democrats and Republicans have really talked about what you do in terms of how to accomplish something with bipartisanship, which is never a case. It's just cherry picking off one or two Democrats or one or two Republicans.
Antjuan, hold on just a second, because some of this I want to focus on if we were to take this dialogue that we're having right now and transplant it back to 2009, a lot of the same things were being said about the then Obamacare plan, about it being partisan, about being forced and ramrodded. Now, if we can take politics out of it, and I don't know how we could, what are the observations about a new Trump plan?
Well, the people may change, but the issues will remain the same. And let's just say hypothetically, even if the Republicans pass disaster care, because that's what I call it, because it is literally going to be a disaster for our economy, it's going to be a disaster for millions of people. Even if they pass the bill, next year we're still going to be having a discussion about health care in this country because it's so complex. At the end of the day, this is a system that they're talking about implementing, if this bill passes, that will literally take millions of people off health care coverage and deny them access. In South Carolina, we have 300,000 working people who do not have health insurance because we have a government that refused to expand Medicaid. And in a lot of states, including these moderate Senate Republicans, that's going to be the question. Are we going to take millions of people off the Medicaid rolls? And that's the biggest issue with the proposed disaster care by the Senate Republicans.
I would say, too, that it's a fundamental issue that cuts at ideology, progressives and conservatives, which is now just a matter of saying Democrats and Republicans, is about the size and scope of government. And that is the issue for Republicans and Democrats. And it won't change given any particulars that you have. It's fundamental to the issue, fundamental to the parties.
Here's what's going to be a game-changing issue if we get to this place of destroying what's in place now. When the people who perhaps voted for the Republicans or voted for Mr. Trump, when they no longer have the health care that they once had, and then it's going to be a game changer for the system. And then it's going to be, let's throw the bums out again, attitude times 10.
Yeah, okay, never a dull moment. In 30 seconds, literally, I want to bring our guest in because it will have some opinion on healthcare for sure. In literally 30 seconds, Susan, does the urban-rural divide factor play into and make even more acute this issue of health care?
Absolutely, and I think we looked at both the suburban and the urban. That was a big issue. I think that it's going to continue to be an issue, and I think people more and more are starting to identify in terms of little communities, whether it's urban, rural, red and blue. That's still there, even though red and blue may be a real blunt instrument.
Agree or disagree with that?
Disagree. It's part of it, but it's really about the have and have-nots. because there's some portions in rural America in which there are haves, and there's some parts in urban America where you have the have-nots. But that's what it all boils down to. If you're a have-not, you will never be at the table, so therefore you will always be on the menu. But if you're a have, you will always be at the table, therefore you will decide who's on the menu. And I think you can couch that with any of the issues we face in our politics.
Thank you. We're going to bring our guest on just a second here. Coming up next week on the program, former South Carolina Governor Jim Hodges will join us again. And also in future weeks, not long down the road at all, talking about health care and medical. Medical Mutual Group's CEO in North Carolina, his name is Dale Jenkins. Dale will also be on our program, promising to be two very good programs this summer. You know, it's hard to argue our guest's resume if you just glanced at it. If you take a closer look, you would find someone that could run a payer, an insurance company, or a provider. He has almost equal and elegant experience doing both, and at the senior level. He is a former senior staffer at the White House, former administrator responsible for Medicare and Medicaid, director of the CDC, professor in University Public Health, and oh yeah, a pediatrician. We are joined again and welcome the Dean of the UNC School of Medicine and the Chief Executive Officer of UNC Healthcare, Dr. William Roper. Dr. Roper, welcome back.
Chris, I'm glad to be here. Thank you.
And I guess you are a good example for saying who says that pediatricians don't get paid well.
We're working on it.
A little cheeky, but thank you. Dr. Roper, you heard the conversation. You know a little bit about healthcare in this country. You know, I want to ask you, let's start with an overarching issue. You know, through all the machinations, all the debates around policy, all the points at Democrats and Republicans, is this almost 20% of this nation's GDP, is it doing what it's supposed to do and dropping morbidity and mortality rates?
Yeah. We as a country are healthier than we have ever been before. We've had amazing breakthroughs in diagnosis and treatment of illnesses. Prevention is achieving many good things. The problem is we're spending way too much money because it's inefficiently distributed and applied. Way too many people are left out of the benefit of these things that I was just alluding to. And we could do so much better if we just put our mind to it and did some pretty straightforward things that would improve the way we organize and deliver and finance health and healthcare in America.
What would be straightforward? What's not an easy fix, but a simple approach?
Well, again, good question. Nothing about it is simple, so I need, first of all, to admit that. Healthcare and healthcare finance and delivery is extremely complicated. I don't think we can do simple and straightforward things, even elegantly simple things, unless we find a way to get past this partisan divide that your guests were already talking about. People are so convinced that the other side are the demons that they can't find a way to come together to do things like, let's make sure we get to a place where all Americans are a part of either a public or private health insurance plan, because coverage by health insurance is undeniably good for people. And at the same time, we need to do some things to lower the cost of health care, because it's ridiculously expensive in our country. If we could begin to lower the rhetoric, talk as my experience was 30 years ago in Washington, you talked a bit about that in the introduction, where Republicans and Democrats sat down together and tried to figure out some solutions. That's what we have to get to. My concern about whether it's the Obamacare as it was legislated or the House Republicans' proposal to change all of that, or now the Senate Republicans' proposal to change all of that. These are just slogans. People are yelling at each other. I'm pretty skeptical about making progress.
Susan?
Well, I think that you hit on the polarization. What is it about healthcare policy, which is very contentious, that's unlike our efforts at, say, immigration, income inequality, all these other vexing issues that sometimes are packaged. And I think I hear you say it's that comprehensive omnibus legislation that healthcare has become, that you can't pick and choose. It's either my way or the highway, whether it was Hillary care, Obamacare, Trump care.
Well, I think that's the difference, Susan, Dr. Roberts, is healthcare is woefully complicated, and as I like to say, everything is connected to everything else. So you can't turn this dial without it affecting this other part of the system. Just to choose an example, one part of Obamacare was a mechanism for covering people who did not have health insurance. In order to do that, they chose, and I think they made the right choice, to do it with private health insurance, but you have to subsidize that. In order to make the subsidy work, you've got to tax some people and provide benefits to people who can't afford to pay. And so each of those things are interrelated, and that makes it woefully complicated.
What happens when the system fails? Because we could be in a position, if you look at the version of the Senate Republican plan, there's going to be a lot of people after 2020 who are going to be left out in the street, so to speak. What happens when the system fails? How do we get back to the place of the Barack Obama idea of let's cover these people, let's grow our Medicaid rolls because we have to do that. People are getting older, they're living longer.
Right.
What happens if the system fails? And then what?
Well, Herb Stein, who was head of the Council of Economic Advisors in the Nixon administration, had a saying, things that are unsustainable will stop. You can't go on forever. So if we can agree, as you are saying, that this can't go on, there will be a failure. It will come tumbling down. I guess I'm enough of an optimist to believe that as we get closer to that time, we'll find ways to solve some of these problems. The major thing, though, that is looming out there that seems to have escaped most of the legislators in Washington is this ridiculous expense that we have. We are devoting, as you said in your setup, Chris, almost a fifth of our economy to health care. Other Western industrialized countries do it for about half of that. We could do that as well, but in order to begin to take that on, you got to deal with some of these fundamentals.
So, Doctor, I have a serious question because this impacts me personally. What do you tell a family in South Carolina, North Carolina, rural, in which the hospital has closed or will close because we think it's a good idea to say, put the screws to the Medicaid system? I mean, we had 4 closed in South Carolina, could be more. And what do you tell a family? What do you tell someone? And I'm not talking about people who are just robbing the system, looking for a hand up. These are working people who are working 2 jobs. Just forget about trying to make ends meet. They're putting 2 ends together, hopefully they'll meet. What do you tell those people?
Well, I tell those people we're trying really hard. I'm personally trying really hard to convince everybody in sight that expanding Medicaid is a good idea. Good idea for the economy, good idea for those people you're talking about, good idea for our states generally and the health of our citizens. Sooner or later, I think we're going to find a way to take more money and do more for more people. We may not call it expanding Medicaid because that's come to be seen as a Democrat idea, and Republicans think they need to hate it, though it's, I think, a perfectly good public policy. What I say to folks in rural communities, whether in South Carolina or North Carolina, where I am,
let's call it that.
the have-nots, we need to find a way to deliver health care well to people who live in rural areas. If we set this up as we've got to find a way to keep every hospital in every county in every state just like it is, we're going to fail at that because so much is changing. But we can do it with telemedicine, with urgent care centers, with transportation that moves patients well. And I think we can do it for a whole lot less money than we currently are spending.
You know, that also seems to be driving consolidation. Just recently, Greenville Health Systems and Palmetto Health have decided to merge, and it creates a $4 billion organization. Are we going to see more of this?
Oh, absolutely. Consolidation is happening in healthcare. And I often say to folks, you may hate that or you may think it's a great idea. It doesn't really matter. It's happening. We at UNC are choosing to participate in that consolidation by trying to find the best partners that we can do things that are worthwhile with. I think it would be a mistake for folks to say, we're going to sit over here in our little silo and keep our head down and hope this all goes away, because it's not going to go away. The forces driving consolidation are the power of the payers. They're not getting any smaller.
The insurance companies.
The insurance companies. The sophisticated management that is needed to run these organizations in a modern way. The IT systems, information technology needs are much more complicated than they used to be. So for good and valid reasons, doctors and hospitals are choosing sides and coming together to form larger organizations. We can either rail against that, or we can say, let's do it in a thoughtful way and make sure it serves a public purpose to benefit of the people of North and South Carolina.
So just a quick follow-up to that, Bill. Does UNC hospitals would be a different kind of an animal because it's part of the university system, because it's a teaching and research?
We have our roots in the university and in the state government in North Carolina, but we've spread beyond that. We have partnerships with hospitals in the eastern part of our state and the western part of the state, and looking to see what next is out there, because this move for consolidation that's happening in healthcare is, and people will hate it when I use this example, but it's rather like what happened in the banking industry in the 70s, 80s, 90s. There's still some community banks, and they serve a good purpose, but most people get their banking needs taken care of by a handful of very large multi-state banks. I think that's what's coming in healthcare.
Susan?
Well, and I think going maybe back to a little bit the granular level, but you know, it's framed sometimes by the Republicans as just another entitlement.
Sure.
And for the Democrats or more progressives, it is a safety net. So even though we have you know, a lot of IT questions and medical questions, there's such a climate of uncertainty. And to have people, what would you have on the other end? People understand how to navigate that consolidated system.
Yeah. So I'm what somebody in Washington years ago used to call a bleeding heart conservative. I do believe in safety net institutions and safety net programs. We need to do more and better by Medicaid, as y'all have said already. But we need to operate those programs in thoughtful ways that don't waste the public's money and that allow the programs to serve as many as possible, as broadly as possible. I fear we have so retreated to our corners and are lobbing grenades and shouting at each other that the things that need to be done, which is reform Medicaid so that it really does work better for the millions of Americans that depend on it, a lot of whom have serious disabling conditions, seniors that are in institutions like nursing homes, young people whose through whatever illness have disabilities. That's what Medicaid is specially targeted at. And I fear that unless we can get back to figuring out what's best for the people that are served and then doing that, we're going to undermine the program.
Got about a minute left.
Professor, this current legislation, both the House version and the Senate version, has almost $1 trillion tax cut for wealthy people. You have emphatically declared, even in our private conversations, that the system is broken, it's a money problem, et cetera. Yeah. How can we ever fix the system if the wealthy do not ever pay their fair share?
We can't.
And you mean that in a very bipartisan way.
I mean it in a very bipartisan way. Unfortunately, what we have is, we as a nation, through the political stalemate that we have about 23% of our GDP devoted to government services. We're taxing ourselves at about 19% of
taxing
GDP.
The middle class.
We're taxing everybody and producing about 19% of GDP, and that 4% is the deficit that's growing and growing and growing. We have to find a way to raise more money, that's called taxes, and spend it more effectively, that's called the expenditures. the current situation is just a recipe for that disaster you were predicting.
Disaster care.
We've got, yeah, that's an interesting way to say it. We've got about 30 seconds left, Dr. Roper. You have indicated Medicaid is so important. Would you expect that the Republicans are going to have some coverage now to accept an expansionary Medicaid program sometime? Well,
Medicaid expansion is something that they've been taught to say is bad because it's associated with President Obama. I think we need to find a way to say we want to add enhancements to the Medicaid program and enable it to serve more people in all the states. We probably won't call that expanding Medicaid, but I think that's where we're headed.
Effectively the same. Well, thank you for being on the program. Since you were here, I noticed you were rocking some facial hair. It's attractive. Is that
Thank
from
you, sir.
some will, maybe? Or?
Well, we're working on it.
Yeah, that's good. Antjuan, welcome back to the program. Good to see you again.
So glad to be seen.
Keep up the good fight there, brother.
Glad to be seen.
We're glad to have you on there. And Susan, likewise, thank you for being on the program. Happy summer.
Dr. Susan.
Dr. Susan Roberts.
I wanted to make sure I'm not a medical professional.
Until next week, I'm Chris William. Hope your weekend and your summer are good. Good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, BARINGS, Grant Thornton, Novant Health, Sunoco, Blue Cross Blue Shield of South Carolina, and by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.